please raise your hands, and if you have a question specifically for one of the members, mention to whom is directed.
Heather.
Okay.
Heather Stone. Hi, my question is about iodine. I have Hashimoto, had hypothyroid, it's gone, had hypokalemia, it's gone. I get rid of everything with carnivore and fasting. No thyroid medication. But I still, the Hashimoto came down to a point, came down to like around 200 from over 1,000, and it was kind of just lingering there. So I looked up Dr. Brownstein. He's got a very strong protocol with iodine. And I'm one of the people where I'm in that tiny little percentage where if I touch iodine, all the numbers go up. But he said that as long as you feel fine, he says, just go by how you feel. And I feel great. I have no symptoms. But my antibodies did triple. They were over 1,200. And I'm not nervous yet because I feel fine. My TSH tripled, but it's only like 9 point something. It was 2 point something before. But I still am curious about your thoughts on the iodine, because the way he puts it is, for that small percentage, like me, the numbers will go through the roof, even TSH up to 100. And then once you're saturated, all the numbers will come back down, be normal, and your Hashimoto will be gone. So that's kind of what I'm looking at, but I'm still nervous about it because have not checked. It's been 15 months.
Yeah, I would say this. The research that I have seen is maybe it contradicts Dr. Bronstein a little bit. But the research that I've seen is that when you take iodine, when you have Hashimoto's, it drives up the immune attack on the thyroid, and you're going to see all those antibodies go up significantly.
Yeah.
If you're not looking at antibodies, you may see a decrease in TSH. You may see an increase in thyroid hormones, but the reason you're getting that effect is because you're driving up the immune attack on the thyroid. Yeah. So for me, in my clinical practice, I take everybody off iodine. And you really only need 50 micrograms of iodine daily, and you can get that from animal protein. So that's the research that I've seen. The other thing that the research says is that whenever they iodinize the salt, Hashimoto's went up 100 times. Like in the United States, I think it was 800 times Hashimoto's went up as soon as they added iodine to the salt. Same thing happened in China and India and all the other countries once they iodinized the salt. I think here they did that post-World War II, and that's when we pretty much, for the first time, really see a huge increase in Hashimoto's.
Okay. Now, I had done the 24-hour urine iodine test before, because I went 2 years. I said, no, not everyone needs iodine, because I watched my numbers go wonky.
Yeah.
But I did that test. You're supposed to be at over 90%. I was at 50%. My bromides were through the roof. And even when I took that 50 milligram pill, I had a migraine for 3 days until I started drinking salt water. And I've had to drink salt water just to bring the iodine levels up, because I'm taking like 75 milligrams a day. But you don't do that.
Yeah, I don't think iodine's the only picture there. I think there's probably other things at play. But, I am just going off the research that I've seen and what I've seen in clinical practice. And, almost all of my patients, we can see their antibodies come down pretty significantly. So it's just a different experience that I have. But I suggest that you go do your own research. Just research, put into Google iodine and Hashimoto's, and you're going to get loads of stuff on PubMed.
Yeah. Most of it's against it. Almost everything's against iodine except
it is
Dr.
mostly
Brownstein.
against it, and that's what I see in clinical practice.
Right.
Hello, my question is for Carrie Mann. Okay, when you were speaking, you mentioned no appendix and no gallbladder and
No brain.
And as I told you, and a few of my carnivore friends know, I had an infection and almost died of organ failure in February, and they had to remove my gallbladder because it was the size of a softball. And thank God my kidneys were spared. However, I am having really trouble. Was high-fat carnivore because of mental health. It reversed all my psychiatric meds of 30 years. But I'm having a hard time adjusting how much fatty meat I can eat without a gallbladder. Do you have any suggestions? What am I doing wrong?
Yeah, that's a great question. A lot of us carnivores don't have gallbladders. Who doesn't have a gallbladder here? Yeah, quite a few. It's tricky. I was very blessed. I kind of eased into it. I know a lot of people will use like ox bile. I don't know if you've tried that. I think that helps some people.
I'm kind of nervous about not using that because Kelly Hogan said she hasn't had a gallbladder for 14 years and she's never been on any digestive enzymes or ox bile.
Yeah.
So I'm like, does that mean like different people should take that?
Yeah, it's a tough one. It's hard if you're struggling. The best thing for me was when I started carnivore, I didn't realize until I learned from Dr. Kiltz that it should be called fativore. And I wasn't having a ton of fat when I first started, so accidentally I kind of leaned into having more and more fat. So I think that really helped me. I didn't really have to use the ox bile. I think I might have tried it like once or twice, but I just got going right into it, and I went a little bit slower, and that's what worked for me. But I'm sorry, I don't know if this is much helpful for you, but yeah, what are your side effects when you go too high?
It just seems like I'll go like a whole week without having any movements, and all of a sudden it's like my whole intestine empties in one morning.
Okay, so let me just get this straight. So you're on a carnivore high-fat diet, and your amount of fat goes up, and as it increases, your number of the frequency for bowel movements decreases?
Yeah, but like, so I don't get the runs anymore, but it's more like, I'm sorry for the TMI.
We all poop.
I just want to clarify because I had the same question she has. Higher fat means higher frequency for you? No.
Lower frequency.
It means lower frequency.
When I do have a movement, it's like the whole week's worth in one movement.
That's normal for carnivores.
I don't
Because
think
the colon is a storage device. When it's full, it lets go. A standard diet, 3 meals a day, you're pooping many times a day. Your colon's always full when you eat fatty meat, and it really truly should be fatty raw meat is the healthiest thing to eat. If you look at Pottinger's cats, a lot of problems is people cook their meat, which may be another problem. But essentially, the fat you eat goes in the lymphatics and it's absorbed and it's stored in your body, so you're getting a lot less in the colon. I mean, really, you never see fat in the poop. Never. That's a real big pathology if you have that. So it's not good. So, and your pancreas makes lipases, and basically your liver still makes all the bile for.
So you can still do it OMAD or 2MAD and be okay, or do you have to eat 3 or 4 smaller meals like the regular doctors tell you to do?
No, never do that. I mean, you should go days without eating. That's the very best thing. We're built for fasting. We're built for days, if not weeks, of fasting in our natural environment. So, but I always look at Pottinger's cats. There's really good stuff there.
All right. Next question. Do we have?
Hi, my question's for Dr. Stone. I'm curious about your opinion on Graves' disease, and would your advice be in line with Hashimoto's, or are there key things that would differentiate?
Yeah, so Graves' disease is obviously another autoimmune disease, but the immune system attacks a different mechanism of the thyroid. So typically with Graves' disease, they either take your thyroid out, they irradiate the thyroid, they kill it, and then that's it. And then they put you on thyroid medication, but they never handle the underlying autoimmune issue, which still has to be handled or it will turn into other autoimmune diseases. So when someone I'm working with Graves' disease, essentially we go through the same thing as we do with Hashimoto's, is to make sure that you're handling all the underlying triggers that would cause the immune system to attack the body. But the only difference really is that they've either killed the thyroid or they've taken the thyroid out. But now you still have to handle the balancing of the body.
Hi, everyone. My name's Scott. My question is for anyone who might have some information on this. I have a complete ligament tear in my wrist. And while Carnivore has been very good for that 8-year-old tear now, I'm curious your thoughts about the incorporation of something like fermented foods that are high in vitamin C, which supposedly Google says will help ligaments to grow, or if you think more of a strict carnivore would be a better way to go.
One thing I did not also mention in my prior speech is that I helped myself heal along with Carnivore with medical grade hyperbaric oxygen therapy, 2.0 atmospheric minimum, as to make sure that your body can actually, angiogenesis, through creation of red blood vessels to stimulate regeneration of damaged tissue in the body. Thank you.
To clarify that if you have a complete tear,
Yes, yeah, a complete scapholunate tear in both wrists, actually. It's recommended to have surgery, but I've held off on it, and it's stabilized a bit, but hasn't healed.
after 8 years, they still want to do surgery? Where the tissue's gone, right?
It's true, yes.
Yeah, so I think you missed that opportunity. So good job that your wrists still work like they're supposed to mostly.
Yeah, mostly. The only
Okay.
issue, I can't get into a push-up position, but
Okay.
they work otherwise.
So your question was about vitamin C and what? Ask the question again now.
It's mostly about the optimum way for a ligament to potentially heal. So,
Okay. So first of all, they have to touch. Okay, when they no longer touch, that's really hard to put down the matrix for which you can grow these other fibroblasts to repair something. The enemy is inflammation. Yes, the inflammation is what's going to happen right after an injury, and that's supposed to recruit your white blood cells in to take care of the problem. And then the chronic inflammation is what really tears down that production of elastin and the fibrin to repair the process. It's, vitamin C is important to have there, but you have to deliver it there. And if you're in the way of a bunch of goo, a bunch of inflammation, I don't care if you're IV mainlining whatever vitamin C, it's not going to get to the place and do its job when you have to fight inflammation at the local level. So you look at hyperbaric oxygen, great data on that, really helpful in, again, anti-inflammatory, even at the space of a fibroblast. But you got to go in with a ketogenic state. If you're looking for a really slowly repairing part of our body is a tendon. And so the reason it's a long game is you got to remove the inflammation. You can't cheat and have, ho-hos every other day. You're going to end up with reversing every bit that you repaired. But you do need to start with them touching. So that's where...
And fermented foods may not add any benefit there. But the hyperbaric oxygen makes sense because inflammation, you think it brings in a vascular nature, but it also depletes it and reduces oxygen concentration in those areas. Correct? Good. Is there another question here?
There's another question here before, please. I need a microphone.
Oh, you got it up there? You got one?
Yeah.
Well, it's actually going back to Dr. Stone. Are there doctors in our area that we can find that will help with the thyroid? I have Hashimoto's, and some of the stuff you're saying, I'm like, I never heard of it. And I take Armor, but I take 240 milligrams a day, and iodine. So the iodine's going to go. I'm just going to, but is there a list where we can find, because like I told my doctor I was doing keto because I also have type 2 diabetes and carnivore, and they get so upset with me. And it's like, I'm not taking any insulin. My numbers are down. What can you argue that with? So I'm really trying to find an endocrinologist that I could work with and stay carnivore.
It's so frustrating to have so much improvement and your doctor says, yeah, but it's going to kill you.
Where do you live? Okay. I don't know of anybody personally in Connecticut, but if you search for a functional medicine practitioner, you're going to find someone who is much more open to helping you in ordering labs and doing that type of work. So a functional medicine practitioner will be kind of the way to go.
Dr. Baker is open in all 50 states right now. Rivero.com. You can find a carnivore
And there happens to be a functional medicine provider here, because I was sitting next to her doing our lunch. You want to stand up? Linda Abel, and she's here in Massachusetts. She's a Massachusetts native and still lives here.
I'm a one-stop shop, so I'm also a personal trainer. I do holistic nutrition. I do functional labs, and I specialize with everybody but women, perimenopause, menopause, trying to get stronger, leaner, the works. So yeah.
Good afternoon, everyone. My name is Linda. I live about 20 miles north of here. And I just want to tell my recent story that I have experienced. And I've had autoimmune problems for most of my life. But the trend, whatever it just has happened to me basically over the life, I think is due to probably a lot of antibiotics when I was a kid, when I had a lot of mastoid ear infections, and I had pneumonia, and I had bronchitis, and a few other things. But in recent years, when I was about 27 years old, first of all, I was diagnosed with Hashimoto's, and given up the levothyroxine, which I'm still on, and didn't really think of that as an autoimmune disease in my own head, but since then, as you know, autoimmune continues to develop. So my next autoimmune disease was when I was around 27. I got Guillain-Barré syndrome, and I don't know if you all know what that is, but kind of devastating. And then in 2019, I got pulmonary arterial hypertension, and just past June 4th, I started to get sick. I felt like I was maybe getting a flu or something. I didn't know what was going on. And so I stayed home from work. I was lethargic and tired. And that happened for the next couple of days. I called my PCP on Friday of the June 6th and got a telehealth medicine appointment at 11 in the morning. That didn't help me any. So my husband was at work. So I just said, I'm going to go lay down on the bed. And I had slight temperature, but it kept fluctuating, and I just wasn't feeling any better. I was just feeling crappy, is the way I put it. He came home and found me on the floor in the bedroom with my head wedged between the nightstand and the bed. And I probably had 103 temp and delirious. And I understand what delirious is because I was that way when I was 8 years old with pneumonia and ended up in the hospital. So I was out of my head, basically. And so he took me, he got the paramedics, and we went to the hospital. And you get to the emergency room, and they said, oh, you have COVID. Well, I've never had COVID in my life, but I had to take the shots every once in a while because I'm a caregiver. And I finally stopped them and got COVID. Next day, he also got COVID, by the way, separate. I had the gastrointestinal kind, and he got the respiratory kind. But on top of my PAH, that was a good thing because I didn't want to have respiratory issues. And it didn't affect me that way. So next day, was it Saturday? I was still out of it. I was in the hospital, and my stomach started to contract all over, just constant contraction. Number one, I do not have a gallbladder. That was a while ago. I got that taken out. And so the contractions, I didn't know what that was, so I talked to the hospitalist. He says, oh, maybe we should take you down for a stomach CT scan. So they did. And I already said to him, I hope this isn't appendicitis. I don't know what it feels like, but I always know it was on the right side and pain. I didn't have any pain. It wasn't on the right side. It was everywhere. But it was appendicitis, and my appendix had ruptured. And so I was taken to emergency surgery to have my appendix removed. So that was done. And about a couple of days later, the surgeon called me and said, we did a pathology on your appendix, and we found stage 1 endocrine tumor in your appendix. You know, you need to come back and talk to an oncologist. So then they're telling me I have cancer. So long story short here is that basically I had COVID, I had my appendix burst, and then it got into my blood, you know, so it was an infection. And then I had sepsis. And then the treatment they were trying to give me was any kind of antibiotic they could come up with, and it had to be intravenously. And so, you know, I put up with that for a while, and I was in CCU for a while, and because of my PAH, they were worried about that. I don't know if you know what PAH is. It's pulmonary arterial hypertension. It's a breathing issue. And so, anyway, long story short is, I felt like I was trapped in this hospital. I felt like I was a hostage, because he couldn't come and visit because he was sick. And I'm very outspoken about my health because I've had to deal with it for a long time. And I said to them, look, finally, give me an answer. When am I getting out of here? And, oh, well, whenever. You know, it's a slow-growing bacteria, and we have to try different drugs and, you know, whatever. So I said, one day I just said, I'm going tomorrow, deal with it. Tell me what I have to do to get out of here. So I had to sign off on that. And I'm wobbly now because the fluid hasn't gone out of my legs and my feet. And, but I've been through it, so to speak. And what I have learned from all of this, the hospital system stinks. I don't like the hospitalist idea. And I have a pulmonologist I called immediately when I got home. And I've always had to kind of stand up for myself with him. And I have an appointment to say to him, look, you took me off all my medication when I was in the hospital that they gave me. He didn't take me off, the hospitalist did. So my 2 specialty drugs, my levothyroxine and my furosemide, were taken away from me. So I had no medication that I normally take. And I didn't die, so do I still need them? You know? And so that's the appointment I got coming up, okay? I also have an appointment coming up with the surgeon to convince me to get rid of this hernia that I've had forever, which I'm not touching, but nobody's ever said anything to me about it because I had 4 C-sections. So that's what caused it, but I don't know what my point is in all of this, except to share.
Linda, that is basically what we're all suffering from in this world of standard medicine. And ultimately, our diets have been very deadly to all of us, and especially a ruptured appendix, for sure. Yes?
Since 2021, I think I went on I ate asparagus, and I ate summer squash for a few months. I lost 60 pounds, but I gained it right back again. So I tried Carnivore in 2022, and I haven't been 100%. I've just been here and there, but added more meat and fat to my diet. And I think that what happened to me with my body is that Carnivore expelled my appendix to get rid of the cancer.
Well, cancer is an inflammatory condition. We do know that, and it's secondary to a plant-based, low animal fat diet, most likely. But the medical system is screwed, and we need to fix it. And that's what we're all looking to get more ideas. Let me get the next question. Did you have a question? You have one up there? Go.
Question, and then I see a hand up back there.
Okay.
Is this alive? Yeah. Okay. Today is my 135th day carniversary.
Woo!
Together with my wife, Naira, we have been both carnivore at the same time. We were both carb addicts before, and maybe a little worse than that in some ways. And but when we decided to go carnivore, we have not cheated at all. And my wife said to me, we're kind of newlyweds, 3 years now. And she said that because I don't go to the doctor, I haven't been to the doctor for 15 years. And she said, well, you're going to go to the doctor and get a checkup, because I want to see if you're going to live longer. And so especially now with the carnivore diet, I want to see whether you're going to die on me. So I want to know, So I agreed. I went to the VA because I'm a Marine Corps veteran. And when I got my lab tests, my doctor's eyes crossed because my cholesterol had gone up to 422. And my triglycerides are 145, and my what they call HDL, the good cholesterol, had actually gone down to about 40. So I don't understand that because I've been doing everything exactly right, and yet it seems like the cholesterol has gone through the roof. Some people have called me like a walking stick of butter, So, yeah, but I do have a CAC of 0. So I don't know if those other things are important or not with the CAC of 0 or not. And that's what my question is.
That's the microphone they're using. I think this question is for Dr. Boss.
Let's say you can do this one. Well, so first of all, congratulations on the transition, whether that's marriage plus carnivore and you're still surviving.
135 days.
Yeah, right.
4 months.
Right. So, yeah, when I look at folks on a newly keto. Amen. Woo! So you said something that your cholesterol was and now is. So the one you just had was how long?
Well, I had 2 tests.
Oh, how far apart?
Just about 3 months.
Okay.
Yeah, no, two, was it 1, 2?
So less than 6 months is fine.
Okay,
So.
and it was, the first one was 300.
Yeah, so it went up, it changed. When you first change onto a carnivore or ketogenic diet, and you've got metabolic problems, don't look for at least 6 months. Yeah, see, the key is you have to be in this, there is a whole bunch of things transitioning. And it's like, you blind the doctor, and then you open their eyes, and then you blind them again for how much is changing in a short-term spot check of cholesterol. And the truth is, the cholesterol that they're checking, the most alarming thing that you said there was that your triglycerides were that high. That tells me, first of all, don't look. But if you had that high of a triglyceride 6-9 months into a ketogenic diet, I would talk to you about you're eating too late at night, you're eating too much volume of food. Those triglycerides should be less than 100, closer to 70 than what you've got. And what you're looking at there is those images that I had about the fat coming out of a liver. Yours isn't able to get back in the liver. You've got, and that really is what we are looking at when we're looking at cholesterol. Praise God, you've got a coronary artery calcium score of 0. But when you churn cholesterol that high in a highly inflamed setting, you're making disease, okay? We know that. When you say, but I'm keto, or I'm carnivore, okay, be keto carnivore enough to reduce the inflammation, and then we get to start having a much more normal conversation. There are ways to look at the best way to check about somebody's cholesterol on whether or not it's causing heart disease or not causing heart disease is after that little drop of fat leaves your liver, how long does it take to go on its little route, deliver the fat to the cells that need it, and then be recycled back into the liver? What is the residency time? The time it lives in your blood. That is the biggest predictor of whether or not you're making heart disease or not. And you can check that, but do not look for the next, don't look at those numbers, put those away, pretend you don't have them. And then when you're stable, yeah, give yourself 6 months. Getting a lipid profile isn't the worst thing in the world, but let's hope that those triglycerides are in the 2 digits. Your HDL is higher than it is right now because that should be better. that LDL and total cholesterol are not going to be my favorite things to look at on a lipid panel for a keto carnivore person.
And see if you can convince your doctor at the VA to do an NMR lipoprotein profile. That would give you a lot better information than just the typical.
I'm back here. Does your body make anything good or bad? I mean, this idea that your body would make something to harm you makes no sense. It all happens from what you breathe, drink, and eat. So it's inflammation. The markers are probably very inaccurate. We know they are. Even the CAC score is inaccurate. But we're maybe don't do so much testing. I don't think you're very helpful personally. Question back here.
Hi, so I am a PhD student at Smith College School for Social Work, and I am also trying to collect knowledge and information that would allow our providers to give us more accurate advice. And so what I'm wanting is to collect stories. I'm doing a qualitative study of the relationship between ketogenic or carnivore diets and mental health. So if that would be something anybody would be interested in, anyone who's been on a ketogenic or carnivore diet for 6 months to a year and has experienced improvement in their mental health, whether or not you've been on medications or discontinued medications, and you would be willing to participate, come see me, or you can email me at jabullock@smith.edu.
Anyone here had improvement in the mental health on keto or carnivore? There you go. All right, next question.
Hi, I'm Lori Calabrese. Hi, Lori Calabrese, and I'm a psychiatrist working in that space using keto carnivore for mental health. This is an open question to the entire panel. I'm very curious about what your experience has been in teaching and working with your own children and grandchildren. Yeah, teaching and working with your own children and grandchildren and nieces and nephews now that you've so successfully adopted a carnivore diet. It's one of the challenges I have as a physician in the patients that I treat, because my patients often come to me and say, I'm good. Now what do I do? With my family, with my daughter, with my son who won't listen, with my husband, with my sister, what do I do? So I'm curious about what you've done.
You can lead a horse to water, but you can't make him carnivore. Thank you for the question. We have, it's my husband right here, we have 3 sons, 3 adult sons, and we just saw 2 of them last night for dinner. And they're very respectful to me, to us, about what we eat. However, I wish that they would eat more of a carnivore diet for their health. And they tease me, they say silly things, but they are respectful to how I eat. And I am coming to terms, I've been on the diet for 14 months now, and I'm coming to terms that I cannot change them. You know, and it goes for everything too, not just for diet. Since they were little, I mean, I could feed them their meals, right? And they could eat it or not, but I wasn't responsible for them as they left the house. They could eat anything they want at a friend's house or whatever. I teach them, I tell them what I do, but they know better than me, you know? So they're much smarter. So they do what they want to do. And I think I have to come to terms with they're not going to do it.
Be the example.
Yes.
Most important thing we can do is always just be the example.
Yeah, lead by example, because, like I said, you can't make anybody want what you want for them, right? And one of the things I talk about in my group with people with their families, like somebody who's, let's say, grandparents, and the grandchildren come over, and they're used to whatever grandma doesn't have that in her house anymore, but we have bacon. And just have lots of bacon, always cooked. Kids love bacon. Grandma doesn't have cookies anymore. I don't know, but we've got bacon. Over and over and over.
Who was the woman I was talking to earlier with the grandchild? It was you. It was you.
I made rib bones since she was
watch my granddaughter 3 days a week, and I just feed her rib bones, lamb chops. I mean, she eats better than anybody else. Rib steak, I cut a big rib steak, the inside part, and let her just suck all the juice out of it. I can't do anything when they leave my house, but when my 6-year-old granddaughter comes over after school, she goes, "Grandma, what kind of meat am I having today?"
So it's very important what Dr. Kilt said, be the example. Tomorrow will be, I said, 2-year carniversary. One of my sons just went carnivore 3 weeks ago, and he just texted me today, I've lost 15 pounds.
And the other thing I do is I fill their freezer with meat. And I got them a freezer filled with meat. And my daughter, who's breastfeeding, Julio, 4 months, notices Julio gets sick whenever she eats spicy or some plant of some sort. So she really focuses mostly on meat, and she's really careful. But she keeps on. Every time she makes a mistake, it's like, I told you so. All right, next question. Maybe just one more, and then we're.
Hi.
Okay, then we'll try to get those 3, but we need to make it quickly.
Hi, I'm so
Okay.
glad that we've turned to this topic because that was what my question is about, and it's for anyone who can give me some direction. I've asked a few people today already. Chris, you helped me. But I'm, in the last 5 years, considered the crazy carnivore conspiracy theorist mom, I think. And we have 2 grandchildren. They're 2.5 years old and 1 year old. And this is something I'm very interested in. Is there anybody in that space that can direct the young moms, because we are seeing that we're all in a similar age group, and it's so important to get these young moms in. And I actually left my professional job 2 years ago, full-time job, so I could spend more time with our grandchildren. And when we have them at our house, we feed them carnivore. And for the most part, our daughter is pretty clean, and she buys a lot of really good stuff. But they also like to do takeout, and they do burritos and pizza. And recently, our 2.5-year-old granddaughter has let out these sharp screams all of a sudden, and she says she has pain. And I'm concerned it's because we're doing carnivore, then she goes home and she has SAD diet, and it's not a good dynamic. And I also, because I left my full-time job, I went to work at a small family daycare because I wanted to see what's happening with the young moms, both diet, and I do that 2 days a week. Diet and vaccines, I was interested in seeing that with my own eyes. And the diet is Doritos and gummy bears and, oh my goodness, what is the peanut butter jelly round little thing? The Uncrustables. It's all sugar. And but now we know better. So how do we get the young moms, and is there anyone in that?
Be the example, because
First of all, actually, the first part is exactly lead by example. I just turned 40 a few days ago, and went skydiving my 40th, but I'm still doing stunts. I'm actually doing a lot more contests during this campaign, but my nephews look up to me as the more fun uncle, and it's actually in shape, and both of their dads are, 40, 50 pounds overweight, so they kind of looked up to me to be the better example. So you're always going to have these influences in any childhood's life, including school and the parents. And the problem is you can't completely control or know what the school is teaching your kid at all times. So it is your best interest to be the better parent, the better influential parent, to eventually reach them, and they can probably get the attention that this is the type of person I want to be, rather than what this institution's grooming to be. So I think a lot of people can recognize that. And the other part is, part of my administration is to make some changes with I'm not sure if it's futile, because I got a dietetic technician registered credential, but with the AND, which is the Academy of Nutrition and Dietetics, which kind of governs some of the nutritional guidelines for the schools. So that's just part of my theory is let's start making it a little bit more wide known.
Okay, thank you.
we have one question here, one behind her. Either one.
You can pass it forward first, and then we'll go back.
Yeah.
And really the most important part is what we're sharing here today, and then we do this more and more, as and I have a book called Babies for Babies, which is basically on how we should be feeding our moms and our kids a carnivore diet. And that's the whole intent of what we're all doing here. As a fertility doc, an OBGYN, and a fertility specialist, it really is, the more we share it, the more they're going to go like, oh man, they're doing that. Look at this guy, how he looks and how they're feeling, and kind of keto and carnivore. That's what we're here to do. So,
hi, I'm Stacy. I've lived 30 minutes south of here. It's great to be here today with everyone. My question is for Dr. Boss. I thought you just did a video recently about HRT, and my question is, how do you see the carnivore diet affecting postmenopausal women's hormones levels and their need or not for hormone replacement therapy?
That's a great question. So again, hormones of perimenopause and postmenopause are fat-based. Your sex hormones are fat-based. They all fall under the rule of insulin. So insulin will tell them if they get to move around, if they get to talk to the other cells, if they get to do their job, or if they stay or get deposited into storage, which is your fat cells. So when a woman comes into my practice, the first place I focus isn't her hormone replacement therapy. It is her metabolism. Because I can give you all kinds of hormones. I can give testosterone shots to a man, but insulin resistant. That one too. It truly is a trap to lead with the hormones as opposed to lead with their insulin resistance. So the best part of helping somebody who's in perimenopause and has had years of excessive weight gain, I've done this a few times with patients. The easiest to do on a home DIY it yourself is one of those hormones that goes into storage is vitamin D. Having a vitamin D check with a finger prick is possible. And I've done it every week when somebody was really in a high fat loss. They're not taking vitamin D. They've had low vitamin D forever, but when they're in a ketogenic state and they're losing weight, their vitamin D it's impressive how quickly we can make it go up, like to 80 to 90 to 100 to places where you'd say, oh, isn't that too high? No, it's exiting from where it's been stored and it's in circulation. So again, when folks are struggling is when you can get their attention. When I look at advice for kids, yeah, I've been through this. It is your role as a parent is very powerful, but it is most powerful as the example. And when I wait for them to have pain in their life, and then maybe they'll hear some advice. The same thing happens with a patient, though. When they come in and say, I want hormone replacement therapy, I'm going through menopause, these hot flashes suck, I'm like, you got to do it. Your job is first. You have got to get that sugar controlled. You have got to get that insulin down. I need you on a ketogenic diet. I can give you hormones, but all we're going to do is make a mess and make your risk higher. You can mobilize hormones tomorrow when you're in a state of ketosis, and then they lose the weight, their body gets better. Sometimes they get their return to fertility, be careful. And it's wonderful. Perimenopause is the time to be having that conversation because those are when the symptoms are the worst. The more difficult conversation are the women that are 70 now saying, can you write my hormone replacement therapy? It's been 10 years since I've even thought about it, and now you're saying it might not be such a bad idea to have someone on it. That's a different conversation.
One last question.
Hi, I'm Amy from Rhode Island. I don't really know who to direct it to. I'm new in carnivore. I've dipped my toe in for a few years, but it was hard for me to start. So now I have psoriatic arthritis diagnosed at Brigham's and psoriasis. So I went very strict for a week, and in a week I started passing my one of 3 kidney stones, which is not fun. So I have one lodge, well, it's kind of stuck by gravity. It's a big one, so they want to take it out surgically. But I was told to not do carnivore because they don't know what it is, and it could be uric acid, and my uric acid in my blood is high. So they said, why don't you wait till we take the stone out and we can test it and then go back on carnivore. But if I stop carnivore, which I've done before, it's very hard to get back on. So I didn't stop. I'm still on it because I'm afraid to come off it, but I don't know when the procedure is going to be. So it could be a few weeks, could be a month, or if I start passing it right away, I don't know. But I don't want to stop. But should I don't know. uric acid, because they said the meat or the high protein or it will make them grow larger if that's what it's made of, was the point.
So uric acid typically is an insulin resistance marker. So when uric acid goes up, I know that people have a fructose metabolism issue and they have issues with their blood sugar. So going on carnivore is actually going to help that. It's going to decrease your uric acid because you're going to stabilize your blood sugar. That's typically what I see.
Their real question was, because they didn't know what carnivore was going to do. They didn't know what carnivore was, right? They don't even know what it is. But ultimately, what human being, doctors and experts, and who should not go on a carnivore diet? Dead people. Zombies. Next question. We're here technically till 6 o'clock. We can either stop questions and mingle or just keep questions. What's the vote? There you go.
All right, this is totally opposite of the last one, and probably opposite of everyone in the room. I've been carnivore 4 years, and my cholesterol is really low, and it's dropping. Like a year ago, total was 150. Now it's 141. So I'm just wondering if that's an okay thing, because I'm thinking no for the brain. Well, HDL is 57, triglycerides 61.
My take on that is that I don't think it's a problem, but when your cholesterol goes up, you know it's a blood sugar issue, a liver issue, or a thyroid issue, and your cholesterol seems to be fine. I mean, you don't want it too low. In ideal, you want it around 150, but I wouldn't get too worried about 140.
Do you ever notice when you get a test, the first thing you do is worry about what it means? And doesn't that cause stress and strain? And then often you go to the doctor, they do another test or a diagnostic test that might be invasive. And what then could happen? Complication, right, Chris?
By the way, did I hear correctly? Your triglycerides and HDL basically are the same number, 4 points apart. That's great.
Look at David Diamond's work on all this cholesterol, fat stuff. It's pretty much all bogus in my opinion. Sorry.
They say that if it's so low, it can affect dementia and all that stuff.
You fine?
Over now?
Yeah.
Hold on, what's that question? Yeah. So hold on, you're worried
Based
cholesterol
on
could
what?
be too low that you have dementia? A baby is growing a brain, and their total cholesterol is 60. You got nothing to worry about. Every cell that needs cholesterol can make it.
You heard it from Dr. Bob. Joe.
It was a year ago. I used Old Spice deodorant, and I had a severe burning sensation in my armpit after using it. And I'm curious, what do you guys use, and what do you find works best for you?
This is real.
Good.
All right. Since there is actually, you know what? I had the same exact issue with Old Spice. It's interesting you bring that up. So yeah, it started causing some rashes. So there is some. I think I choose from like 7 different brands on Amazon, just some beef tallow, and I try not to use. They use too many essential oils. Sometimes the essential oils can even be. If you're that sensitive, like me, like I have to go complete lion. I can't even do dairy and eggs. I have to go straight meat, and preferably raw meat, to be honest with you. But anyways, there is a huge amount of tallow deodorants now that actually have like some kind of mixed, essential oils, but some that are non-fragrant. That's a lot healthier for your pits than Old Spice. So yeah, beef fat is your solution for all of your problems.
Or none at all.
Joe.
Gee.
Joe, I think it is against the law for someone who's 22 to use Old Spice.
We have two questions back here. Go ahead.
Sure. One of my questions, I actually have two, if I can be greedy. But one of those questions is I'm trying to get my mother to join me on this journey. And well, kind of, but she's pretty resistant. You know, she's bought into all the dogma, right? And one of those things that she has is gout, and they have taught her, the doctors have taught her and reinforced that meat is the cause of that gout. And I think we know that's not the truth, but how to counter that argument or what kind of substantiation to give her. And then the other one is for you, Dr. Kiltz, because in your pamphlet, you had indicated that yogurt was one of the foods to avoid. And throughout the years, I've kind of dabbled in like the SCD and the GAPS, you know, the kind of like 24-hour yogurt is one of the things that's allowed in those diets. I think Christopher had indicated that he had been in that space. And so I'm curious if that would change your perspective on yogurt. If it were well-cultured, is that the offending thing, or would that not have any impact on your
So
assessment?
we're basically back to something that was asked here before. Be the example and listen to Dr.
Yeah, I
William.
would say it, you know, you can lead a horse to water, you can't make her a carnivore. But one thing that I find is beneficial is if you go into YouTube and in the search box type carnivore gout, those two words, you'll probably get 8 or 12 videos of Dr. Berry, Dr. Sean Baker talking about how carnivore does not cause gout, and you might want to just happen to have it on next to you when your mom is sitting next to you.
Listen to it with.
Does she eat only fatty meat?
No.
Well, then how can you say it's meat that causes gout? But they say lots of things. Remember to keep us domesticated.
Yes, yes.
That's it. And then yogurt. What is yogurt made out of? What? Milk. Right? And then you add bugs to it. I'm not going to eat stuff with bugs anyway, right? The yeast, right? Bacteria? Right. Which is good for us or bad for us?
Well, it depends. Sometimes
Which one's good, which one's bad? I think it's also unscientific science, my opinion. Bugs are bad in us, but they're everywhere, right? Bugs are everywhere, but they're sometimes good and sometimes bad. It's like cholesterol, sometimes good and sometimes bad, but it's still your cholesterol, right? But I don't touch yogurt. Ice cream.
Okay. Next
Okay.
question.
Oh, hi. I decided to ask, but I don't know, it's already been answered maybe. I have autoimmune and cancer, but I started this very low carb diet 3 years ago because of that autoimmune inflammation. Now, my cholesterol went up crazy. LDL crazy is 350, cholesterol 460, other numbers good. My A1C, almost no sugar, keep going up, not high. 5.6, 5.7, but keeping, not lower, going up. No, it's not high, but it's not going down, it's going up. What else? T3 is lower. I don't know the number, but it's lower. It got lower. So I'm kind of not sure. Should I continue? Should I do just meat? No yogurt, which I eat, actually. Or kefir, I drink. Should I completely be just really lion diet? Or, I feel like my inflammation is still up. It's not, my autoimmune didn't get worse, didn't get better.
What kind of cancer is it?
Lymphoma. And the autoimmune is Sjogren's. Didn't get better. So I'm not sure. I want to keep going, but should I try more meat and fat? No dairy, no kefir, no eggs.
What's the interval between the drop in that A1C?
The A1C.
Or the raise in your A1C,
raising.
excuse me. Yeah.
A year.
Yeah.
So let's say for 2 years it stays same,
Mhm.
and then last year, it went up a little bit.
Okay, only by a decimal point,
Yeah,
though?
it's not
Okay,
much,
so
no.
That's minimal change. So you worry when an A1C stays, it's close to 6, you said? 5.7?
Yeah.
5.7? That's a higher sugar than you'd like. Are your morning fasting sugars okay?
I did try the glucose, actually, the monitor, and that stayed pretty much in my, like the morning would be
Is
a
it
little bit
2 to
higher, but then like 90.
Okay.
And dropped under low at night a couple times.
Okay.
So that kind of stayed in 90s, let's say, and 140 maybe in the morning, 130, and then kind
Hold
of
on,
down
your
to
blood
90.
sugar is 140 in the morning?
Maybe, like
Yeah.
a
So-
100, 140, and then 90, 80 during the day.
So, and you look pretty lean from here.
I lost 35 pounds
So
over 3 years.
You've lost weight, you've got a blood sugar that's high in the morning, you've got an A1C that's not decreasing proportional to what would be expected,
Mhm.
and you've got 2 diseases that are highly linked to an immune system that's not
Yeah.
working right, yeah.
Yeah.
So the chances that that immune system took a left turn at Albuquerque and started attacking your beta cells and you aren't making as much insulin as you think you are is what the biggest worry on the plate is. You can check that with antibodies specific to those beta cells, which would give us a clue, is that what is happening? But it would not be the first time I've seen you're doing a lot of things right, but you still need a minimum level of insulin to get the job done. And your doctors should look at that. So it isn't that you aren't strict enough. It's that, yep, you're doing things great, but there are diseases that are in churn right now, and I would check for that. Does that make sense? See what
Checking
I'm talking
a peptide and checking antibodies against the pancreas.
Yeah, that's what I do.
With a fasting insulin.
But carnivore is going to be the diet.
Amen. Yeah, that's
Right on. Fatty meat. We had a question over here.
I know you talk about how you put a steak in the fridge and dry age it, shave it and all that. We were just trying to figure out how to do that. So can you walk us through the process?
Yes, please.
That, yeah, it's raw, right?
Because you said I should eat raw meat, so we're trying to ascertain how to do this plan.
Well, ultimately, raw meat is what we evolved on. Who's waiting for the cook? Right? What other animal cooks their food? Only humans. And we cook our animals' foods also, which are not good for them. So ultimately, fatty raw meat is the best thing to eat, because when you cook something, it's kind of like, let's light fire to your car before you use it or your house. What does it do? It damages the molecules that control it, right? So when you cook meat, you damage the molecules that that meat is made of, which may actually lower the availability of whatever nutrients, minerals, vitamins, other things for our body, right? So that's why I always look at people, and so if you're not getting the very best out of carnivore, just like Pottinger's cats that ate cooked meat and pasteurized milk were unhealthy, and their subsequent generations were unhealthy. So when we talk about carnivore, it really should be fatty raw meat. Okay, so now I dry age my meat in a refrigerator on a rack, let the air go past it for 1, 2, 3, 4, 5 days, sometimes a week or two, some cases. The thicker the better. Well, histamine reactions is an inflammatory reaction, right? Histamine's naturally, so some people may get more of that from dry-aged meats, but leaner meats for sure. But the fattier meat, I don't think we get them as much. But you may get some, because what grows on the outside of the meat? Bacteria. Is it good or bad for the meat? Well, I don't know that answer completely. It could be bad, but most of it is harmless for us. I mean, I eat it all the time, and I don't see a problem, even raw. But generally, I black and blue my meat, which means I sear it, and so it usually kills those microbes, I suspect. But it's cold on the inside and raw generally, because I cook thick meats in general. I don't cut it off, but I pull it out, cook it, salt it up. That's all I do. Add butter, and that's it. I tolerate it very well. Oh, I will slice it up and put it in a bowl. They're really tiny. Yeah, I just have little bites. I don't use a dehydrator. I don't do anything special. I just put it in the refrigerator and works. I have a dry ager also, but it's just another refrigerator with a light in there and circulation of air. Yeah, because I don't eat anything else pretty much. What's that? No. But I will eat old cream. You know, the older it gets, the nicer it gets to me. Even like way past dates. And I love what is it, clotted cream? That is like the very best. And Detweiler's down in Florida. You could buy raw milk and you could raw cream. Like the cream is it's like sour cream, but it's just cream. Is like the very best, and raw butter. The raw is probably the very best for us. And I don't know if we're going to change the laws in America to allow us to all eat our dog and cat's raw milk.
About the question with the dry aging, I usually take a picanha or a rib section, slice it into steaks, put it in a tray, salt it, both sides, and put it in the refrigerator. It will never last 5 days in my house, but you can taste the dry aging, and you don't have to be, if you dry age something for 21 days or 30 days, you have to slice off the cover. You don't? No? Okay. Well, it never lasts more than 5 days in the refrigerator, so. And then you can cook it or not. That's up to you.
Remember, salt and fat are anti-inflammatory, right? Thank you. And so that's why adding salt is, I think, really good for that. Go ahead.
So, okay, I see a raised hand. We're going to do that. I guess 1, 2, 3. We are supposed to leave here by 6, so we would like to have half an hour to mingle, maybe. So we'll take 1 minute per person. Huh?
They can ask questions when they mingle.
Yes. They can, Go ahead.
I'm on the board of a nonprofit that helps with addiction and mental health, and I'm imagining Carnivore is good for helping with addiction specifically. We know mental health. I didn't know if there are books or doctors specifically connecting the benefits for addiction with Carnivore.
So I know there's Chris Palmer and Georgia Eade. They're both Boston-based doctors from Harvard, and they both talk about mental health in the carnivore diet or the keto diet. But I don't know if there's anyone specifically for addiction. Does one of you know?
Well, Dr. Siwas calls them the carb addiction doctors, so. But,
a book.
Yeah, book. I don't know if he's got anything. Talk to Tony when then get him the information. That'd be good. Okay?
Good afternoon, everyone. My name is Jennifer Edmiston. First, I want to thank everybody for here and all the advice and everything else. I'm an individual that lives with type 1 diabetes. I'm coming up on 32 years strong with it. I have been in the keto diet for 3.5 years now, carnivore for probably the last 1.5 years, but I have to switch back and forth. Along with wearing an insulin pump, I also take an SGLT2 inhibitor as well as a GLP-1. I find that after about 3 days of strict carnivore, I do have to add some carbohydrates in because my ketones go way too high. My blood ketones go to 5, 6, 7, and I feel just absolutely awful. Any advice on that?
I have to make a comment. I'm not your doctor. You're not my patient. Anyone on a keto diet or carnivore diet that's on an SGLT2, I tell them, if it's my patient in my room, I take them off immediately. Because they, by themselves, can cause ketoacidosis.
Mm-hmm.
And it just, and I use them, by the way, on my past life, but I don't think anyone on keto or carnivore maybe should be on that class of medication. What do you think, Dr. Boss?
Same thing? Okay.
And you're doing a lot of things right. If you were a type 1 diabetic that had 3 or 4 days into that strict use and you were popping up that high, I would make sure that there is a couple, you're eating a couple of times a day. I mean, how often do you eat during the day?
Twice.
Okay, so keep that present. But most of my type 1s, once they really transition into that space, their ketones come back down to that 1.5 to 2 after they push through that.
Okay.
I don't like that you don't feel good, and I don't like that you're on that med. So that would be the warnings I would have too. They are persistent. And the other great thing is when they're making a lot of ketones, just send them for a workout.
I do.
Yeah.
I get on my bicycle or go cross-country skiing in the winter.
Yay, that's great. I mean, there's a way that you can solve that, but that drug makes everybody up here nervous.
All right, thank you.
I will say there's a podcast, but I don't remember who it was, but this guy, he wasn't even a type 1 diabetic, and he was on that drug, and it made him have ketoacidosis, and he ended up in the hospital, and they couldn't figure it out for a while, and then somebody finally knew that it was because of the drug. It can happen to anybody. It's not because you're a type 1 diabetic.
We'll do one more and then we'll close it up. And we'll do.
Hi, thank you. Dr. Vasquez, I have the leg cramps as well, but on Carnivore, why would you need a supplement?
You probably don't, but there are some carnivores that, so low carbohydrate diets and carnivore diets are very diuretic. That was probably the first thing that anyone here that lost weight noticed, right? You lose a lot of fluid. There is no pure water in our body. Our water also always moves with electrolytes. So the moment you go low carb, go carnivore, you start definitely peeing more, you start moving more urine, more fluids out of your body, and they never go by themselves. They always carry sodium, potassium, chloride, magnesium. So I always had cramps even before carnivore. So I have found my sweet spot in the amount of magnesium that I take. I also use a generous amount of salt during the day. I carry salt in my bag. I've been stopped by TSA because of my salt. Tested. They tested. So it hasn't been only sardines they stopped me for. They tested my salt thinking it was, I don't know, cocaine or... I always carry salt. So do anyone who goes into carnivore or low carbohydrate diet need a supplement? No, if you listen to Dr. Kills, and I'm frequently there, I used to be very heavy into supplements many years ago. I'm not anymore. But sometimes you need, in my case, I need the magnesium for the cramps, otherwise I'm going to have them.
There's one supplement that's the most important supplement.
Fat.
As our good friend Ben Azadi says, is vitamin G. It's gratitude.
Gratitude.
That's the most important thing. Yes. And I got to tell you how grateful I am to everyone here.
And I'll just say vitamin P for patience.
Persistence in the process of life.